The High Vibe Nation is live. Welcome to the High Vibe Nation, where we have set out to raise the vibration of every human being on the planet. Your hosts on this journey are Sherry Gideons, Pamela Aubrey, and Christy Jones. So let's join them now in their current interview with a high-vibing individual.
Hello, everyone.
Hello.
Welcome to the High Vibe Nation. Such a joy to be here with all of you this evening. We're here with a very special guest, Dr. Tony, who's a partner at Euclid Chiropractic with Dr. Brian Weaver in the Inland Empire for over 17 years. This practice helps thousands of patients a year understand the cause of their symptoms through x-rays, analysis, specific adjustments, and patient home exercises. Dr. Tony enjoys sharing his healthy knowledge through community and school workshops and interviews with professionals in the healthcare field on our podcast. So thank you so much for being with us, Dr. Tony.
Of course.
Such a pleasure to have you here. So tell us a little bit about where you're from and what your life was like growing up.
Great. I grew up in West LA, went to school out there, a beach bum kind of guy. I loved being out there for one, too. It was great. Went to Loyola High School, went to East Riverside, UCR. It's kind of from UCR to where I am now in Upland. It's not too far of a stretch. So allowed me to kind of see the Inland Empire versus the beach area. And then looking at overall where I wanted to live, do I want to live the concrete jungle in LA, or do I want to live more where there's more, I guess, more openness for one, too? I like it out here, and I've been made it my home the last, I want to say, almost 25 years now, because it's made me part of the community. When I was going to chiropractic school in Whittier, that allowed me to come out here and volunteer and find internships, even when I was just starting school, allowed me to find the practice I wanted to be in. Where I am right now, I've been here for about 15 years. I started as an associate, as an employee down the street in Rancho Cucamonga, as Christian mentioned earlier. It allowed me to kind of get the experience from a senior doctor, now buying into this practice 15 years ago. Now I've kind of bought into, okay, I'm part of the community. I'm part of the Upland Chamber. I go down the street, I know about 5 people on the way home. A lot of it is making my personal brand my office brand. By doing things like this and doing podcasts such as yourselves too, allows me to educate my community, make them part of sometimes my personal life, along with my professional patients for one also.
Yeah, that's awesome. And Dr. Tony, we met about 3 years ago.
Exactly. Yep.
Now, right. And, you know, I've always been so impressed with how you educate people and just your energy level. And I'm wondering, you know, what if you could share with us what kind of set you apart as made you such a high vibe individual?
My biggest thing is we have a good practice. Pays for everything I need, pays for my family stuff. My thing is, how do I promote that vibe to the actual community? People that need it the most, that, for example, want to get off of medications, want to live a healthy lifestyle, are depressed, are anxious, basically just don't like their lives right now. How do I make myself a high vibe person, and at that point promote that and get people to see that so they can get that high sensation also? The way I do it, I work out every day. In the morning, my thing is I have an old coffee maker. I start it and stretch for 15 minutes a day. Once I do that, I go and walk my dog for about 10, 15 minutes. That's how I start my day every day. As long as it's not raining too bad, overall, it's pretty good. But how do I promote that with everything that's going on is I want people to see my energy level here so they know, okay, what can I reach? Can I be the example for my community? At that point, spread the word through my interns, through the Upland Chamber, through other businesses like you had mentioned too in the area, even a little bit further, Glendora, allow them to see the benefit of being a healthy person, a healthy practice, promoting health overall.
I love that because, you know, I spent so many years in the personal training industry. And, you know, when people would come into my environment, they can feel where you're coming from in yourself. And especially if they're, you know, in that mindset that they want to improve their lives. And especially in your field, the thing that I love the most about you, because I watch so many of your own podcasts and I've seen how you've inspired these people. And I love, you know, the playful nature you come from too. So how do you start with the basic principles with people? You know, they come to you in a painful situation,
Of course.
and you know, they want to feel better, but how do you start with them, the basics?
The way we start, like any, I want to say, the way I promote, I tell my interns too, because they want to be health professionals, whatever it might be, is how do you get to know the person? Well, who is the person? How do you show that caring attitude? And I always start with my interns, especially, how do you smile at them? How do you make them feel comfortable? How do you get them, like you're doing right now, nod their head?
Right.
So they understand and you understand what they're going through. Once you have that sympathy for what's going on with them and get to know that person, it only takes a few minutes, not to spend 3 hours with the person. And then from there, can you go, okay, how do I figure out where the problem's coming from? Have them understand that also, because sometimes they don't know. At that point, walk them through a routine. Okay, if that's where the problem came from, maybe a pain in the neck or lower back, how do we find that out? I pause for a second and go, the way we find it out is sometimes do an x-ray analysis. We have a machine in our office, it's up to date, it's computerized, you can see on the screen right away. At that point, there's no waiting time. I'm a very impatient person. Okay, I don't like to wait for anything. So I want to see things right away. I'm not going to send them out for x-rays or I'll see you in 2 weeks. I want to see things right away, see if I can find the cause of your problem. At that point, help reduce the pain today. I want to give them what they're here for. I want their expectation is, I'm here for pain relief. How do I help you today? And by taking x-rays first, I can see exactly where the cause is, then be more efficient and effective to find that pain source. Then from there, dig down to give you that, okay, it feels better. Wow. Once I get them to go from the adjustment, at that point, set up and go, that feels a little bit better. Now I know I got it. Then they wake up to, okay, how did you find out what's going on? Because now I feel better. I found out what I wanted is here. What's the next step? Yeah. So if I can, I'm going to give them that relief up front. That when they see the benefit, and I back them up to, okay, this is where we came from. I repeat what we did the x-ray room because now they're in less pain. This is how we find out exactly how to fix this thing. Not only do you feel better, then actually we heal the problem so it goes away completely. That's every patient's different, right?
Wow.
Sometimes they come in, some people come in, they have a fracture. They, God forbid, have a tumor or something else going on. Here's your x-rays. Let's go to the emergency room right away. But I want to take all the risk out by taking x-rays first so I don't miss anything. And then from there, give them the benefit of the chiropractic treatments.
Yeah. Like it.
That's so great. So for people, for anyone who hasn't ever maybe been to a chiropractor, what does it really mean to get an adjustment or a spinal adjustment?
Good question. The spinal adjustment allows the bones to move normal again. We're all born for the most part with normal bones and normal joint motion. What's a spinal misalignment, which is what chiropractic kind of uses that term, is the bones are not sitting properly, either in a normal curve in the spine for one, or the bones be shifted left and right. If that's been happening over time, it can over time not cause any problems. But all of a sudden you wake up one morning and you go to pick up your pencil or toothbrush, and all of a sudden your back goes out. It hits the nerve. The nerve is what we're trying to get to calm down over time, to change that nerve amplitude or energy level. That point, that vibration of the nerve, again, high vibration, that vibration nerve allows things to become optimal again, where it doesn't cause any pain, can handle normal load over time. And at that point, feel better by causing more joint motion. The joints stick in the spine. Between the bones, there's a disc. That disc between the bones, it can shrink over time and hit that nerve to make that nerve want to fire right away. Our job is calm that down, hopefully with the adjustment. At that point, keep the joint loose enough so it gets back to normal motion. That point, nerve can calm down over time and stay that way.
Wow. And so a lot of what you're working with, I'm hearing, is really the nervous system.
Yes.
And what I'm loving that I'm hearing too is that you give people an experience, right? They come in and you're helping them shift and get out of pain, which when you're making those adjustments, I believe you're working with the nervous system.
We're working with the nervous system to calm it down, but the problem is perception chiropractic is we move bones.
You move
so
bones.
We have to, okay. So I want to get them to go from here are your bones on an x-ray and seeing the alignment may be normal or abnormal. Then from there, I switch them from now here are the bones where it's being stuck, not moving properly, hitting the nerve. Then from there, we calm the nerve down so the bone and the muscle feels better. That's the point.
Okay.
So we do that over time.
Okay, so that goes over time. And I'm wondering, what do you see? You know, there's such an emphasis on the mind-body connection.
Yes, there is.
I'm wondering,
you brought that up.
Yes, so I'd love for you to share a little bit about that.
When someone's been in chronic pain for a long time, sometimes a month, 2 months, I've had people for 10 years had pain. They've on pain medications, not working for them. Now that pain is causing problems sleeping, problems with anxiety, depression. Quality of life has gone from being very good to now they don't leave their own home. So what happens, in my sense, when the body gets to that point, not only is that back pain a problem locally, or even a neck pain problem locally, now it's caused those nerves to go to the brain become under stress also. When that happens, your hormone levels will shift, and they'll shift to going from evenly cortisol catecholamines, pain receptors, to relaxers, your adrenaline endorphins, where that's gone off, where now your cortisol catecholamines are up. Those hormones, pain hormones, make your body stay in pain. Where do hormones go? Anywhere in the blood. So it affects all your organs, your brain, your muscles, excuse me, everything in your body. So now people come in not only with problems with their neck pain, now that nerve's gone to the brain, causing the whole body to become under stress. That comes with palpitations. Coming with problems where they have problems with urination, defecation for one also. Problems even eating. So a lot of it is, can we calm those problems down by finding the source of the problem, getting the body to de-stress over time. So we're affecting the nervous system where the whole nervous system affects stress in the body. That's when those hormones re-regulate over time. May take 3 or 4, 5, 6 weeks. That's when the body get back to normal state of health versus being off the whole time.
That's so interesting that you bring that up, because I myself had to have my back replaced. I had a lower fusion, 5 years ago or now, and it was related in my case to degenerative disc disease.
Of course.
But there was also a lot that came into play around years of abuse with eating disorders, and then I'm in my 50s now. I'm classified as a senior citizen now, and I'm dealing with sleep issues, and I'm dealing with hormone issues as well. So how do these apply to women? I mean, let's use women, for example, who are over 50 and they're having issues with sleep, and they're having issues with the hormonal issues.
And my biggest thing with them, with that age bracket, from when maybe male or female, is how much do you move? How much do you move your body? And again, it looks like you're 35, so I'm not going to say anything about what you look like. But someone that comes in that way sometimes may not move enough because they're in pain. And when you're in pain, our body tells us not to move, because if we move, it causes more pain. We go to our doctor, MD or DO, and go, same thing. If you're in pain, don't move. Here's some more medications so you feel better. Right. My biggest concern, my number one priority, is getting them to move just a little bit more over time, and for them to see that movement, maybe a light stretch at home, just something light. At that point, get them to feel that benefit. Okay, now I feel a bit better. Why is that? How do I add one more exercise? So unlike your situation, to where you were a healthy person, sometimes people are just naive. They don't know what health is. They've run to a medical doctor every time they have a problem, tells them not to move. Now their bodies become more arthritic, more stuck, more stiff. We have to break that habit. Once you've done that over time, I had a patient, quick, are you okay with patient story? Is that okay?
Absolutely.
Yes.
Rachel, really nice lady, Hispanic, in her, I want to say 63, 64. She came in 4 or 5 years ago, about maybe low 60s. Came in, bilateral leg pain, just not very happy at all, upset. Not the anxious, more just the upset older person. I took her x-ray. She had been on medication for about 2 years. And the same thing was told, if it hurts, don't move. So her back pain went from back pain to leg pain, now overall body weakness. Took her x-rays. I said, Rachel, your x-rays are fine. Why aren't you moving more? My doctor told me not to. I said, if you don't want to, and she came in a walker, if you don't end up in a wheelchair, at home, someone helping you get up every day, which I knew she'd want to do, you have to start moving. First of all, she got angry at me. How dare you tell me what I should be doing when I was told this over here? Started moving. Took her about 2 weeks of cursing me out in different languages, coming in for treatment, because she was helping, even though she was fighting it. But you know what? I've gone from walker to a cane now. And over about maybe a month period, I've gone from a cane once in a while, but now I start walking out without the cane. And now, as far as I hear, I've seen her for about 6 months. She walks 45 minutes a day, no cane, no walker, and now smiles. God forbid she smiles, he's happy. But when you're in pain all the time, going back to it, how does it affect our mood, our mindset, overall body chemistry, hormonal levels, everything? By simply moving sometimes and moving the right direction, the right things, once we move the bones, now you can work out to where you feel the benefit. Someone like yourself, Sherry, where you're healthy as it is, I may say, hey, let's move the bones, back off routine a little bit, and then let's build it up again. Now we have joint motion. Now the spine can handle more load by what you're doing. And then we can actually get the benefit of chiropractic in addition to what you're doing already.
I like that you're saying that. Yeah, you know why I like that you're saying that? Because in combination with that, I was dealing with severe bursitis.
Okay. Yeah.
So
that makes sense.
So it makes sense, like you're talking about, because when I was going through physical therapy, they were saying very much what like you were saying now. And they were doing simple movements, teaching me simple movements that, in all my years of personal training, I'm like, this just seems so simple.
I people come from physical therapy and go, this is a waste of my time. I can go to the gym by myself.
Yeah.
But again, physical therapist is looking to work with you. Sometimes it's hard to read how much you can do versus so it's not sore down the line. But because you're a healthy person, okay, how do I do more? Because I know it's helping me. So I want people to understand too. It's good. Go into it. I want them to understand if what I give them doing at home or even with physical therapy, if it's helping, you're going to feel maybe a little sore the next day. If it's too much, you may feel pain or it just doesn't feel right at all. Or if it wasn't enough of a workout, you may feel nothing at all. So I want them to kind of learn how to judge themselves. Okay, how am I feeling? How do I wake up the next day? How do I become it in my mind over time? I want them to learn, become their best doctor, the best physical therapist, their best self, to read themselves. At that point, am I doing enough, not enough, or too much? And how do I judge that so I know for my own personal body, I'm getting healthier every day? That's my plan with my patients.
I love that we're talking about this. I'm sorry. Go ahead.
Go ahead, Pamela. Go ahead.
I was just going to say, I love that we're talking about this because I actually recently had an incident. I mean, I think it's important that people understand that, it's not, chiropractic isn't necessarily something you just do when there's something wrong either. Exactly. So that there's a myriad of reasons that you could do this, but that it can, benefit you just on a consistent basis. I personally have scoliosis. So for me, it's like almost critical. I mean, I just have to go every so often, right? But actually recently I had altitude sickness and my first thought was I'm going to go to the chiropractor because I hadn't had an adjustment for a little while. And so maybe can you talk about some of the things that chiropractic can be useful for outside of, just getting aligned and just getting our bodies working the way they need to?
Good. So once one of my patients are, for example, out of pain and they're feeling looser and stronger and just more energy, maybe less anxious, maybe a better state of health, I want them to go, remember this moment, see how you feel. This is a better state of health for you. How do we maintain that? Part of chiropractic is getting the body to get healthier by having the self-regulation of knowing how your body feels and what feels good to you. So my job as chiropractic is, yes, we can help people with allergies, yes, we can help people with altitude sickness, we can help people with blood pressure too. But how do we get them to understand the link there, the link to where, okay, if I'm not myself and I feel something off my body, is it because I have a lack of medication, a lack of water, something else going on, or something I can't see, I can't feel? And if it's been there for more than 2-3 days, can my chiropractic help me? And my thing is I want them to go once, and those my best patients are ones that I see maybe 10, 15 times a year. Because they get to a little bit of funk, they come in, take care of it, they're back to their normal habits, healthy habits, hopefully. At that point, they stay there because they know it helps them work and kind of gets them to a better state. So with chiropractic, the goal is to get the body to self-regulate again to a healthier state, and from there maintain it on its own, again, with good healthy habits.
Yeah, I love that. And I think there's just so many things that chiropractic is useful for. And one of my thoughts is, do you recommend chiropractic for children? And how can that benefit them? Starting really that health regimen at a young age.
And again, I'm not a neonatal chiropractor, there's a specialty for that. So a child that, for example, is under 5 to 7 years old, okay, they can sometimes benefit from a neonatal chiropractor where they adjust the bones very softly and they know their specialty, know their stuff. I deal with kids that are probably 5, 7 years old, active up to up to 99 years old. But those early ages of 5 to 7 to about 21, 22, the body and brain are still growing. And they have to grow together in a healthy state. If not, like scoliosis, Pamela, allows your body to grow at a limitation to where now you have to really watch your body the rest of your life to keep it healthy. So my job is to make sure that nervous system, again, Christy, allows to stay free. At that point, the flow between the body and mind, the spinal cord and the brain allows to stay, that flow can stay consistent and can actually stay on its own. So with what you do too with the breathing exercise, we talked about with motion before, allows the motion inside the spine to keep that body loose, those bones loose, nerves work properly. So now the working out, the breathing exercise you had mentioned before too, and everything that we can do to keep our kids healthy and active and moving, even the mindset of the brain allows to work at a higher level. If you do that long enough, again, through their teen years, especially when their hormones are kind of off balance everywhere, like ours was, at least mine was,
right.
And my daughter, I don't know who they were.
Hormones aren't off balance.
I don't know who they were, but allows them to get through that period to where now if I'm feeling this way, how do I learn my habits over time so they can take that in their teen years like you do with them, Christy, also beyond the two in their 20s, 30s, and 40s. So now they know how to self-regulate their own body and keep their body healthy on their own. And what we do in chiropractic, especially with girls in their mid-teens when their body starts to develop, is we want to work on their posture. If posture is off, and going to posture right now, posture is off, it blocks the nerve flow, allows spine to lock up versus that healthy process. Now the brain and the body can't work together properly. So my job is work on their mindset of where posture should be, then get them to maintain that over time. So through their teen years, I'm on them to make sure their body stays back against the wall, for example, maintain that posture over time. They see that overall benefit.
I like that you're saying that because I have 15 and a half year old twins, and one of them is. Yes, I know you know.
I have two 17-year-old girls. I have a 21-year-old boy and a 26-year-old boy.
It never stops because I have a 31-year-old daughter. I have a 25-year-old son, and then I've got the 15 and a half year old twins. And so one of them is a basketball player and the other one is a cheerleader. So, but she does all of the, she's a flyer. So she's the one they throw up in the air and they, she
has good medical insurance, right?
Yeah. Well, they already dropped her and obviously she broke her arm.
That's dangerous. Yeah, that's what I'm saying. It's a sport based on the chance of injury.
Mm-hmm. And so she has a lot of, questions around, the standing up straight and the back support. And so she's always asking me, what can I do to be more conscious of my back support and make that back stronger so that she doesn't have the back issues and the headaches?
And that's the thing, especially is if you have injuries and try to go play a sport again and haven't really recovered from the injury, even though you feel no pain, how can chiropractic get her to not only feel better with the adjustments, but also retrain her body and even do things at home too, Sherry, where she can learn at that point, maintain her own health by doing posture exercise, by doing neck exercise, help those overall headaches, get the body to relax and heal. She might have it might have muscle imbalance somewhere. The chiropractic may help fix that. And by if I tell my children to do something, there's a 10% chance of them to do it. If you tell my kids do something, they don't even know you, they'll listen to you before me.
Right.
Absolutely right.
So having 2 letters after my name and a big student loan allows me to tell a teenager, for example, 15-year-old, let's try this, this, and this. I'll get more of a nod from them, and over time work with them so they do that to make sure they do it. I had one kid, he wouldn't do his exercise, kind of maturity issue. So I said, you know what, you don't do exercise. I'm going to call you tonight at 6:45 to make sure you do the exercises. I never called him because he had the fear that I would call him. That's why I did his exercises. He goes, that's So it's a mind trick. Doesn't work very often, but it works once in a while. But once because of what I do, I talk to kids in front of their parents so the parents understand the kids are responsible, not them. They have to do it for them, not for the parent.
It sounds like you listen to them too, though. It sounds like you're listening and, allowing them to speak, communicate with you, and then you hear them and then you work in relationship to what's going on with them.
It's listening to not only what they're telling me, where their problems are, but how they say it. Maybe their tone of voice. Is there anxiety in the voice? Is there confidence? Is there overconfidence sometimes? And I even ask them, well, what do you do now? I ask them a lot of questions. I want them to start talking. And again, teenagers are tough in general, because I have teenagers from a local high school here that come and intern for me. They sometimes just do this. They don't talk at all. So my job is to you kind of prod them, poke at them, and maybe even say a bad joke sometimes. Get them to open up a little bit. I want them to smile. That point I know they're listening, and then get them to, okay, what's your name? What do you like to do? Kind of break it down if I need to really low, and then from there build them up over time. So to get the confidence, they can trust me for their benefit. And from there, once they see the benefits of the exercise helping them to feel better, then they know now I can help them get to better state of health and help maintain that over time.
Well, that's great. And along those lines, it just kind of strikes me that part of feeling good is also boosting our immune systems and warding things off. And so how does chiropractic help support that?
Good. If our body, good question, Pamela. Well, I guess some good ones over there. A lot of it is can we get our body to what we're taking in? Say, for example, I take good vitamins, I eat good foods, exercise enough, but I still have this problem. I still have a lower immune system. I'm still on medication because of medications. Is the body, even though you're putting in the right stuff, is the body working functionally well to keep your body healthy? I use my patients called a nerve chart. A nerve chart connects the nerves to not only location of your body, maybe your liver, but how the liver functions. Maybe your stomach, but how your stomach functions. Maybe your intestines, but how the intestine functions. So the body is meant to function at a higher level. So when those nerves are vibrating at a higher level and they vibrate well, then that result is those organs function well. They digest food well. They absorb the enzymes we're giving them. Our colon will absorb the vitamins and minerals we're supposed to absorb back to our bloodstream so our body can function well. Our immune system stays high because one thing, gets right nutrients, right? Okay, it might be deficient. But also if it's under stress, at that point it also lowers our body's immune system also. How do we get their body to lower that stress over time? Maybe exercise, maybe attitude, maybe listening to a funny movie or a funny song. And getting our outside, if you want to call it stressors, beyond our inside to work well for us in a positive way versus negative stressors. Do we watch the news? Do we do things like that are negative stressors for us versus listen to good things that keep our body healthy from the inside out?
Yeah, absolutely. That not watching the news right now is probably highly recommended, I'm assuming.
And from anybody. I have a patient who's a therapist, a psychologist, and it's basically number one thing she tells the patients, not to watch the news. You can reduce your anxiety, increase your immune system by about 20% just by turning off the TV.
Wow. And that's so easy, right? You just turn that off. And, one of the things that I love about you too is that you have your own show called The Crooked Spine Show, right? And you're always educating people and introducing them to other modalities and helping expand their knowledge. And I wondered if you could share a little bit about that, about how you started that. And maybe I
started that, I think, in the fall of 2016. That's when we first met, Christy, I think through Sean.
Yeah.
Group back then. It's all in my head somewhere. A lot of it is I wanted to get the message out. And when I started our social media, per se, back in 2010, 2011, a lot of it was before that, because I'm a little bit older, 46 years old, all we do is Yellow Pages. Yellow Pages, word of mouth, that's all we need to do, right? Done. All of a sudden, Yellow Pages are dying, going away.
I think you're dating yourself a little bit right now.
I know. I'm ancient. My kids I'm a prehistoric era. But a lot of it is, if that's going away, how are we going to tell our patients who we are? And all of a sudden, Yelp became important. Google became important. YouTube became important. So my transition from going from a blank or static website where we put some information on there, maybe an article here and there, maybe a quick video, whatever it was. The video was just like, what's a video? At that point, going from there to YouTube, then from there on Facebook, then Instagram. So going from there and taking my content, which was audio and visual, to just audio, pulling the audio out, putting on a podcast, wasn't a big transition for me. Allowed me to just do another platform to educate more people. My biggest thing when I talk to you about social media and what I do here, everyone turns on their phone, correct?
Yes.
On social media, you pick a social media, TikTok, wherever you want to be. I want to be on your phone, on your TV, on your channel when you turn your phone on. I want to be there every time. So I post 6 days a week, 3 or 4 times a day sometimes, based on how much time I have. Not because I'm I have nothing to do. We saw about 75 people today. Okay.
Wow.
I want to make sure when I'm working and I'm working on, when I'm not seeing the patients, how to work on educating our patients, our community through our videos, through our podcasts, through our short videos, through our clips from even these talks too. So people understand what we do. And then from there, promoting the people in the community allows me a broader range of information about health. My podcast is only about health. Maybe a psychologist, maybe someone in the mindset, maybe even a trainer too. I want enough information so people, when they're ready to see a chiropractor, great. But if not, can they see a trainer? Can they see a nutritionist? Can they see a psychologist and understand what that means to them?
Yeah. Yeah. I love the diversity that you introduce people to, and you're there. It's like they're always supported.
It is. And it always goes back to
there every time.
That's it. And how do we keep ourselves healthy, right? We have to do our due diligence as individuals, because enough information on YouTube, on Instagram, or Facebook of how to get ahead and stay healthy. This show exactly does very similar, where it gets broad range of health professionals to understand how to get healthy on your own and stay that way. Just listen to the audio, right? Watch the video. You can go for a walk, turn the video on, listen for where you walk. Every time, and I'm my best critic, because even when I take my dog for a walk, listening to another podcast, listening to a video, watch something online. So I'm learning even as I go.
Yeah.
That's awesome. We had a question here from one of our guests. And I know it's long, but when vacuuming or loading or unloading the dishwasher, what causes that pain that occurs? Since Corona, I still can't go to our chiropractor. What type of exercises can I do to alleviate the pain? And the pain occurs the first 5 minutes, and right now I just have to stop and rest.
Good. Okay. Good question. The problem is when we're standing up straight, that's basically a 0, right? 0 on the vertical line. Okay. As we bend 5 degrees or 10 degrees into a forward position, then our lower back has to work so we don't fall all the way forward. That's a tough part for the lower back. If the lower back is weak at all, it'll make that area want to spasm or tighten or cause weakness or pain. So what you can do for that position is start doing deadlifts, even just with water bottles, even just where you bend over and pick something up real slow. You can go on YouTube and see how to do a deadlift. At that point, do it very light to make that lower back strong, so that when you come up from the deadlift, make sure that last 10 degrees or so when you come straight up, you hold and then come all the way down real slow. We have to do things that sometimes are what causes the pain to make the pain go away and heal the area. And if you can't see chiropractor right now, at that point, I would even ice it down afterwards until you can't see chiropractor, release that area to make the area move better. But for your question is, I would start doing a really light deadlift, really slow, even against the wall, having your hips against the wall so your body can slowly get stronger over time. I was working with a patient earlier on that, and same thing, she had that same problem. At that point, it took her about a week or so to get over that, because now her back's stronger to handle that load. Yes, that's exactly it. But against the wall, the modified deadlift against the wall, first support your back. Then from there, once you're comfortable, then come off the wall and just use water balls as weights. Or toilet paper, whatever you want to use to start. The same.
That's great. And, I think there's a lot of different little things like that that people deal with on a daily basis. So what's a good way, maybe if someone hasn't been to a chiropractor before, what's a good way for people to know that this is a point at which I should probably seek help?
If you're without weight, if you can move your back, your neck, your hips, your legs, your shoulders without pain in a full range of motion, at that point, you probably don't have to see a chiropractor right now. But if you have limited motion or something feels like it's popping or cracking in any position you're moving, at that point, where is it building up pressure in the joint to where over time it builds up enough pressure where you have that moment where it drops you. You wake up in the morning and you go, okay, now let's go see a chiropractor. But we can limit that motion by doing our own assessment by causing range of motion, each joints of the body, the neck, the mid-back, the shoulders, the lower back, and hips. If they're moving well, okay, maybe hold off a little bit. But if something feels like it's not moving well and you can't get it out of there, where it's normal range of motion, then from there, see a chiropractor, just get an assessment. Okay, what's going on here? Can I prevent that exciting moment where I can't move by seeing someone early enough to make sure I don't have those problems? And then learn what you can do to make sure that motion improves over time at home by doing exercise, stretches, example, to make your body heal over time too. and then get stronger. Obviously, like I said with the deadlifts, if you have osteoporosis, it can still benefit you.
Mm-hmm.
Wow, awesome! So much wisdom and simple. I love that you try and keep it simple.
It's all in my head, Christy.
Yeah.
I don't know what's in there. It's off your tongue, I don't know where it is.
It's as practitioners, we're all some form of a practitioner here. We usually find that so often our best teachers are the people that we work with.
That's it.
And I'm wondering maybe just some maybe inspiring or funny stories of life lessons you've learned, right, in your practice. 17 years, I'm sure there's many that you could share with us.
It's comedy. It's sometimes it's just a comedy day. And I had one guy, he's one of my top videos. He's as big as a standard door, as tall as the door, and as wide as the door. Okay. I was taking extra of him and his wife, and I was adjusting and they were getting adjusted for the first time ever. Because those are always exciting ones, right? I'm like, it'll be fun for me at least. I'll be entertained. I don't know what's going to happen. I adjust his wife first, and he bolts out of the room. He just takes off. Like, where is he going? He goes, he is deathly afraid. So I go, do you mind if we videotape this? He goes, that'd be great. So I adjust her first. She's all done. He lies down. I start adjusting him. He screams every time I adjust his neck left or right, his mid-back, low back, everything. He screams like I'm stabbing him with a knife.
Right.
Loud. Dramatically loud. For a guy that big, dramatically loud. And his little manners were hilarious. His name was Mars. I found out later he's an actor in Hollywood. So he wasn't acting that day. He had that personality. And that happens. The best exciting thing of coming in the office, if it's your first adjustment, I am going to be entertained. If you don't know if you're going to laugh, cry, speak in tongues, have Tourette's, I have no idea.
Right.
To get the person out of the way. And if there's a spouse there, I have them videotape just in case it's a good one.
Right.
That can use on Facebook, YouTube, Instagram, TikTok, especially all those little videos here and there.
Right. So have you had experiences where people speak in tongues?
Yes, I have no idea what they're saying. It's the most exciting and scary thing in their life. So their emotions are just everywhere.
Right.
Great
So
comedy.
Talk about high vibe.
Oh yeah. You have no idea what's going to happen. Their vibe is not even here. They're above the screen.
Right. They're coming from a whole nother realm.
Yeah, exactly. Third dimension. Quantum physics, I guess. I don't know.
Love it.
I love it. Well, and it kind of like connects you to that passion in yourself, because you get to be yourself, and you get to, meet people in the moment, and you just get to have fun, and you create that fun in them too.
Well, I make them understand that, yes, you have a serious problem, but can we make it still, if you want to call it a human connection, where I'm here to help you. Doesn't matter if I have a big license or a big student loan and you are who you are. Are we two people trying to help each other? Can I help you so I connect with you so you understand you can trust me to get you to a better health state, a better vibration with your nerves so things feel better, and over time back to normal state.
I love that you're saying that, because that's what I'm all about. Because even like I was just talking to Christy, and we were talking about creating connection, and using social media as a platform, because a lot of times we want to be perfectionists, and we want to go out there and we're like, oh man, did I really say that? Or what are people thinking? Or this or that. And then, what the real thing that people want to see is they want to see that you're like them. That, you've got things that happen, and, it's all about going out there and creating human connection and showing people that, it's okay.
We're human, right? We're going to make mistakes. Okay. But can we, if you, for example, want to know someone, for example, Abraham Lincoln. Okay. Are you going to watch, you're probably going to know that he was shot in a theater. He was a president. But if you want to get to know someone, you have to almost read a biography or autobiography of that person, so you know the whole story. If you see someone's social media and they post once a month this great edited music and everything else too, and they seem really just all the time on without having a downside, is that really a real person?
Right.
No. You want to see someone at their high moments and low moments, so you know they're genuine when they're feeling good, not feeling good.
Yeah.
You know, I don't want to know someone's every moment of the day, but can I see someone enough? Because that'd be stalking, right, Chris? That's stalking.
Right.
But can we see someone enough to, okay, I've seen this person's material enough, their videos, their audios, their texts, whatever it is, to know this is the real person. When I hire somebody off, when you hire someone for a company, you go, day one, okay, that's it. You're set, ready to go. We're not going to have no problems at all with you. You're going to be 100% perfect. Know what to do? Nothing. We don't. We know someone's going to have problems, right? Insurance too. They're going to come and make mistakes. But can we correct them over time by learning who the person is and hopefully making them a better person over time? But give them a probation period so they know and we know, hey, look, it may work, it may not. We have to give it time to kind of marinate, I call it, so we know exactly what's going on with that person's personality and mindset. Are they really here for me? Or is it a one-time thing for them? At that point, they're not going to put more information out later. That's why I said with Christy, my podcast started in 2016. I go every week. I think I took maybe 1 week off because I was unconscious, maybe. I don't know what happened. But overall time, I keep things going every week because I understand I want people to know they turn their stuff on, I'm going to be there for them. I'm going to be there for them. They may not need chiropractic today because they have a back, because they have problems maybe in the future, in the past. I want to be there when they need it. That's why my phone is, when I'm, at least it's normal hours, I answer messages on my phone probably on the Saturday, 8 o'clock at night, Sunday, 4 o'clock in the afternoon. Because people are leaving me messages from Yelp, from Google, from Facebook. Hey, what about this? Can I get it on Monday? Do you have problems with this? Okay, I want them to get information like myself. I'm if you want to call it not short-tempered, but I'm impatient. I want to find out right away because I said ask a question. I want to answer right away too. So they understand that, hey, look, I'm here for you. But again, it's not 4 o'clock in the morning, but it's not time to where at that point I'll be able to answer the meeting on the weekends too.
Oh, I like that.
Wow.
You know, minutes are free now. You have to pay for minutes anymore, so I have unlimited minutes.
Well, and I love that you touched on, just kind of this idea that, really, being high vibe, so to speak, it's a process, right? Like, it's not like you ever totally arrive in this life. And so it's learning to take the steps you need to take along the way. And
we're talking about being the mindset, right? How do we start here first? I was listening to a hypnotherapist, Ted, and I think he's in Glendora. And a lot of it is the first 10 minutes of your day, you're in a hypnotic state no matter what. Mm-hmm. So can you fill things that first 10, 15, 20 minutes with good things to get your vibration? And chiropractic used vibration back in the 20s and 30s as a way to measure the energy level of nerves, vibration at a higher state to handle the stress of everyday life. Because what does stress do? It lowers in our sense, chiropractic vibration state to a lower state of health, where our immune system drops, where we have sometimes pain or aches here and there, our body's more sensitive to problems. By doing it getting at a higher level when we first wake up in the morning, at that point our body can stay there and then tolerate the stress of everyday life. Then when you add in stretching, we add in exercise, we add in a healthy physical routine, even eating and the diet, nutrition, your body can even tolerate more stress.
Yeah. So that's, do you have something that you recommend in those first 10 minutes?
I exercise it. What I did before is I turned the coffee maker on and stretch for about 15 minutes.
Right. So for you, that's your routine. Do you recommend that same thing to really maximize your clients raising that vibration? Did you call it the chiropractic vibration? That's a new term, right?
And chiropractic have used in through the ages light as a way to measure energy, vibration way to measure energy. Now we have more technology such as EMGs and millivolts. You can measure voltage now. But back then it was more philosophical along with somewhat technical. Again, very barbaric technology what we have in 2020, but it was enough to kind of measure things around. So and I promote what works for that patient. So by understanding the patients, by listening to them, by caring about them, and then trusting me over time, I'll go, I know your morning routine is here. Can we add this here for your morning before you start your day? But I have some people that work different shifts too. So they get off maybe at 8 o'clock in the morning from work. So I go, before you go to bed, do a couple stretches. When you get up in your morning about 4 in the afternoon, maybe try these. Yeah. So I work with their schedule, I customize for them what's going to help them.
Yeah,
so
I love that because it's really like that morning and nighttime, like right before you go to bed, and right when you wake up, that's that hypnotic state. So we really want to take advantage of that time to really create that higher vibration.
Well, you want to be able to create it because some people, they're naive, they just don't know. And how do they normally do it? They turn the phone on. Right before they go to bed, they turn the phone off. Problem is when you do that, now you've decreased your melatonin because of the screen. You decrease your melatonin in your body. Now your body can't get to a deep REM sleep, so you wake up tired and exhausted. We're tired and exhausted, now we're more sensitive. Now we start our day in the negative versus giving ourselves a chance to rest and relax. So I tell my patients, if you want to always ask them. It's always up to you as America still, right? It's not South Korea or something like that. It's America. It's your option. If you want to get healthier, the best thing to do is turn your screen off, maybe read a book or do something, listen to music. So that point your body can sleep and do that about an hour before you go to bed. That point your body gets to full rest versus waking up tired, not having full battery on for the next day.
Yeah. Absolutely.
It's so interesting that you're saying that because I'd like to use I have a couple things I want to address about myself. So one is that I meditated last night for one of the first times before I went to bed.
Okay.
And so I had a meeting with Christy and Pam this morning at 6:00 a.m. and I literally slept right through the alarm because when I hit the pillow after this meditation, I don't remember a thing. I mean, I just fell asleep, like in restful sleep.
You're unconscious. That's good. Well, and again, as we know, there's different phases of sleep, right? There's alpha sleep, beta sleep, where the superficial, where if someone opens the door in another room, you'll hear that and wake up right away.
Right.
The deep REM sleep is where our body goes really unconscious, where it can recharge and really shut down. At that point, get a full battery for the next day and start things over again.
So what was it about that meditation? Was it just like because I was like very deeply into this meditation, it just caused me to go into that REM state?
And because I don't know if I was to guess and really hearing that, is you're able to shut down your mind of all the things you wanted to think about. By doing medication, you're allowed to block all the other stuff out and then really focus on just getting their mind clear. You know, if we do that enough over time and have that routine of doing meditation every night, becomes our routine, so our body knows to shut everything down. You may do it tonight and have a negative effect. You may not sleep at all. But by doing it over a period of maybe a week or 2 weeks, like Christy knows, becomes your habit, unconscious habit, your body knows you're going to do that every day. At that point, it can start shutting down at the same time every time. So over time, you get that deep sleep on a more average amount.
Yeah. And then the other question I wanted to address is, so, you know, I'm a retired professional athlete. And so years ago in competition is when I was still doing gymnastics and I fell on my head. So I lost all the curvature in my neck.
Yeah.
And obviously I did a lot of chiropractic things, you know, to help with that. But like when I'm tired or stressed or I sit too long or, you know, whatever, like, do you see where I'm pressing on the bone
Upper
in
cap.
my neck? Yeah. So that hurts all the time. Like I have to like press on it to make the pain go away.
Do you still lift weights, Sherry?
I do.
Good. Do you shrugs?
I do. And I notice that when I do the shrugs, it sometimes tends to be painful for a couple days.
And what I would do is shrugs and overhead shoulder press, even go a little bit heavier too to handle the load. But make sure too with the screen also, we're doing the screen properly, right? So I'm gonna change my screen right now. I want to make sure that when people are on the computer a lot or even on the phone too, so I can see this properly, are we back here, or are we here? Right. And that's what I worry about. So right now, I see a lot of people coming in the office with neck problems either toward the skull or toward the shoulder because you're doing a lot of sitting in a chair. If our head comes forward, our facial bones and teeth are all the weight of our skull, 80% of the weight of our skull. So that pulls our head naturally forward. Keep our shoulders back and down, allows your body to stay here instead of being here. So what I would do, Sherry, is making sure that we're doing enough shrugs and shoulder press with our head being back, with our ear being by our shoulder here instead of being forward. I'd watch your posture doing that, because right now my biggest thing is you know how to lift weights. Can we lift heavier with better posture structure so our body stays here instead of being here? We've been on this call for about 50 minutes now. What I worry about with longer phone calls or Zooms like this too, what do our eyes do? Our eyes are about maybe 5 feet away from, maybe not 5 feet, maybe 2 feet away from our screen, and it makes our eyes strain. When our eyes strain, we kind of squint, correct? When we squint, where does our neck and shoulders go?
Hunch.
They go up, right? Okay.
Yeah.
By looking away, by changing the way you use your eyes and look further away for maybe every 20 minutes or so, looking past the computer, maybe 20 feet away, allows your eyes to rest so you don't squint and hunch your shoulders. So I'm seeing a lot of that the last, obviously, 3 or 4 months since everything's been on lockdown. So we have to make sure we're doing enough so our body can rest. So even every 20, 30 minutes, taking a break, looking, say, 20, 30 feet away, letting our eyes rest, and even moving our eyes a little bit too, where we widen our eyes so our body relaxes here. So that strain here doesn't compensate by doing this. Realize, again, our eyes are connected to our neck. The first part of our neck, cord tympani branch of the nerve root, neurology again, goes behind the ear, forehead, behind the eye. So if that's tightening here, that's making that nerve fire back here to make your overall neck tight. If you've had previous injuries, Sherry, on that right-hand side, that scar tissue will be the first thing to lock up on you because of the injury when those eyes and those shoulders start coming up and when the eyes start to squint.
Wow, that's huge, because that's exactly what happens.
I just made up. I was watching you earlier. Again, I'm stalking you. I don't know. That's common to happen because people don't realize they go out of their meeting for 4 hours on Zoom, whatever it is, and they're going like this, like, how can my eyes hurt, my neck hurt at the same time? Because they're not doing enough. They don't understand. They just don't know how that their eyes under a certain range will stress versus they need that change in depth over time.
Well, and it's interesting that you say that because, like, when we get on a meeting, Pam and Christy and myself, and we're on a meeting, and if the meeting goes too long, I'll start to feel stress and tired, and my neck will start to hurt.
And it's almost, you want to make sure you kind of stretch your eyes out a little bit to make sure your muscles get the stretch it needs, so your overall eyes don't feel like under pressure. Yep.
So like that?
Exactly. I would go up.
Okay.
And I would go down. To make sure those eyes are getting more motion, more blood flow in your eyelids and the upper and lower muscles of your masstoid bones to make sure they're getting more blood flows, because if you're not moving, there's no blood flow. There's no blood flow in the muscle. What happens? Build up lactic acid and causes pain. The pain won't be here. The pain will be back in your neck.
Yes.
Where the injury was.
Wow. Exactly. Wow. That's
sounds good. We're good, right? I don't know.
I started asking this because I was like, I gotta ask for myself.
Right. I got him here, right?
But again, it goes back to, can we make muscles stronger over time once we've gone through the pain level? We've gone through pain, we've healed the pain. Now we're getting looser, getting more flexible, and we build up strength and power to make our body handle more load. So when I tell people, let's do these exercises, it's not to get away from your work or minimize your work. It's to allow you to do the load you want to do, but keep your body healthy the same amount. So I want people stronger so you can handle more load over time. When you build up strength, you're going to know if you have an injury or not. That's why with your Sherry, I'd want to do higher weighted, lower rep shrugs and shoulder press to make those shoulders and neck stronger to handle some of the load. But again, correct the posture and worry about the eyes so you get enough blood flow in those areas to relax the area.
Love it. Thank you.
That's amazing. Well, and along those lines, you were talking earlier about some stretches. I know those are great in the morning. What are some stretches we can do during the day if we have been sitting at our desk all day on Zooms or just typing over the computer?
Good question, Pamela. I have one or two for you. Okay. I would take your left hand behind your right ear, turn your head to your right shoulder, and let the weight of your arm pull your head down toward your chest. This will help Sherry's right side of her upper trap loosen up a little bit. There we go. So for your Sherry, I'm going to have you do is where you are right now is put your head to the right again, right, Sherry? Now let the weight of your arm, so your left shoulder goes toward your left ear, goes toward down toward your body.
My left ear? Maybe I'm leaning the opposite.
Try the other way. Try the other way first.
Okay.
Go there. Now bring your right hand forward. So your head goes toward, there you go, like that. And turn your head a little bit more to your left shoulder, Sherry. Other left.
This way.
There we go. And then that, there we go. You feel that left side?
Yeah.
There you go. You feel that?
Yes.
Then try this side again. Try the other way. Make sure you got. So try your left hand behind your right ear now. There we go. There we go. Better. Let it come down toward your body. There we go. How's that feel?
Oh my God! Right in the spot.
That's the one.
Yes.
I'll send you the bill in the mail. I'll let you get the bill.
Wow. Oh my God! That's right in the exact spot.
And I would hold that for about at least a minute. The ligament stretch. If we do this and this and this, that's muscle. I don't care about your muscles because they're the pain receptors. I want the ligaments in the bone to stretch. Ligaments connect bone to bone. When you stretch ligaments out, then the bones can move better. It releases the nerve pressure and allows the muscle to get stronger over time. So holding it for at least a minute where it feels tight and uncomfortable but not painful allows you to get the overall benefit on both sides. So 1 minute, both sides minimum.
Wow.
All right. Good seeing you. You enjoyed the stretch and the comedy. Appreciate it.
And I know that we're almost at the end of our hour, but I'm wondering, one of the things that's been a big concern for myself, and I'm sure for you as well, that we work with a lot of children, is that with kids being on screens, they're really saying that they're losing that curve in their neck, and a lot of adults are too. But is there anything else? You gave us some exercises for that, but is there something that you would recommend for kids and adults to really keep that natural curve there? Good.
My number one thing is for the overall body to get in that better straight position. Because one thing, when you're sitting on a computer or a phone or whatever it is, a tablet, whatever you're doing, it's not just the neck, it's the whole body is being hunched forward. Okay, we're all going to do this. So can we actually walk for at least 10, 15 minutes with the weight on our heels so our body's leaning back more? So the movement allows the neck, mid back, and low back together, all of it to get into extension posture versus being set in a flexed or a hunch posture.
Okay, so if you're going to be on the phone, walk.
And put your phone in your pocket. Listen to a podcast like My Crooked Spine Show or the Vibe Nation, either one, whatever you want to do.
Okay.
At that point, keep your body here and keep your body straight. So looking down over your nose at the ground, so you're not looking here. So keeping your body up, looking down, say here, better angle. Here, if you can see me. Instead of looking here with your eyes when you're walking, here and looking down over your nose, so your body stays upright instead of being here. And by walking on your heels, your body stays back. So the muscles of your back that are the strongest, maybe the neck, mid back, or low back, are called erector spinae. They run up and down the spine, erector spinae. They control your position. If you're leaning back more when you're walking, you're making them stronger to hold your body up here instead of being here.
Yeah.
So walking on your heels instead of your toes allows you to maintain that better position, creating your brain and your body together, your brain and body connection. So that point, that position allows you to sit this way and also stand this way to avoid that hunched posture look.
Yeah. And I love that you're strengthening your spine at the same time. Just
all of it. It's like a plural exercise.
Multitasking.
It is, but it's simple. You can do. People go, well, why do I have to do this for? It's 15 minutes consistent. 15 minutes consistent allows your body to really get your brain to calibrate that better position. If you're just walking to the store or whatever it is, or to the other part of the house, you need that consistent walking so your body sees this as normal. Whereas most people walk there, they're leaning too far back because you're not used to it yet. We have to train our brain by motion to recalibrate our position and posture. So you can handle, again, more load. I'm okay for your computer or your phone, but why is it making you sore? What are you doing that you're not negating that stress in your body to make your body, again, stronger, Sherry? So that point your body can handle that load, that stress.
Yeah.
And if you feel comfortable or sore, make sure you do your stretches too, so our body can stretch to get longer muscles and then get strong at the same time.
I'm going to. Don't you think that has a lot to do when you're talking about, standing up straight and you're walking? Don't you think that applies a lot to using our core muscles too and having the core muscles be strong?
Exactly. Our core muscles being our abdominals and our lower back and even hips too. By doing that better position, our core muscles being our abdominals, they don't tighten up and the lower back doesn't weaken. So when we sit too long, our lower back will go from having a normal curve to very straight. When it does that, our body will naturally hunch forward. By standing up and working, like you mentioned, back on our heels, the core muscles have to hold you a better balance point.
Right.
Your center of gravity will back up on your heels. So now the muscles have to adapt to that by making the back, instead of being hunched forward and weak, tighter and stronger. Abdominal stretching and then stronger over time.
Mm-hmm. Mm-hmm.
Mhm.
Love
Is that
it.
a good answer? I don't know. I just mixed up in my head again. I don't know.
Well, it sounded good.
All been perfect. All been perfect. So, Dr. Tony, tell us about how people can get a hold of you. Tell us a little bit about some of the other social media areas that you're focusing on. And
I focus on everything. I want to be everywhere all the time. I use the same content, and my secret is I use the same content on Instagram, on Facebook, on YouTube, on TikTok, on LinkedIn, on whatever else. I just cut it for that actual platform. My thing is I want people to see how to get healthy for the best for them. So I'm on Instagram, Euclid Chiropractic, Euclid, EUCLID. We're in Upland, California, 909-969-3056. Again, all the fish will be in the show notes along with the links that they have been too. My thing is, don't just come and see me, but learn how to get healthy and stay healthy on your own. And at that point, you have questions. I have people coming all the time just for a consultation. Hey, I have a problem with this. What should I do? Give them some stretches to take home. Good, get the heck out of here. I don't even charge them. But I want them to learn how to get healthy. So that's someone out there knowing, okay, this is what I got to do now. Versus running on to take medications and be stuck on that their whole life. And again, chiropractic is really based on educating our patients well, and not to go against medical or the medical model, but how do we keep ourselves healthy and know if we're deficient in something, we add to it, or if we're not moving enough, how do we move more? Again, with Christy, same thing. Once you do that, then our brain and body can work together to keep ourselves healthy, and we learn the good techniques for our own body and maintain that over the rest of our lives. You know, I have another half life to live. I'm only 46 years old.
Right.
I love it. Well, thank you so much for joining us today here on the High Vibe Nation. We want to thank all of our guests for being here with us. We love you as always. Thank you for sharing out this information with all of your social media outlets.
Of course.
And we love all that. Pam, you want to leave us with anything?
Just grateful to be here with all of you as always. Thank you again, Dr. Tony, for being with us. What a joy. And thank you for all the wisdom you've shared with us today.
Good. Hope you're entertained. That's all I'm hoping for.
So thank you for entertaining us and encouraging people to move their body.
Thank you.
Have a great evening, everyone.
Yes, thank you, everyone. Our next guest on Wednesday night at 5:00 p.m. will be the amazing Bob Donnell. He's a human strategist or a human behavioral strategist. So join us here on Wednesday evening at 5:00 p.m. I'm going back in time on the High Vibe Nation. Thank you, everyone, for being with us here tonight. And myself, Pamela Aubrey, and Christy Jones are very grateful for each and every one of you.